Hello everyone, this is Miss Warren, and I'm just emailing a quick video to give you an explanation of what I would like on the EKG interpretation chart. First, what I would like you to do is refer to chapter 36 of your Lewis textbook, the section labeled dysrhythmias, and you'll find a lot of the information there. So first, I would like for you to look up sinus rhythm. And for the rate, I would like you to put what the normal rate is from the SA node. So for sinus rhythm, it's 60 to 100. And then next, it talks about the next column is regularity. And what I would like to know what you're looking for is from the R, the tip of one R to the tip of the next R. Does it occur at a regular interval? And I'll attach another video in addition to this one, which explains how to measure the R to R and also how to interpret a EKG strip. In the next column for P wave, I would like to know, does a P wave occur before the complex, and should it occur? So if it's supposed to have a P wave, such as sinus rhythm, you just put yes. If it's VTach or VFib, are you going to see a P wave? No. So in that column next to VTach or VFib, you would put no. The next column is the PR interval. So with that one, as you watch the video, you'll have a better understanding. You're going to measure from the beginning upslope of the P to the top to the R. And each small box is equal to 0.04. So you just multiply whatever amount of boxes from the beginning of the P, the small boxes, to the R, and then you'll write what the number is. And again, when you watch the second video that's connected to this one, it'll give you a much more in-depth explanation of how to measure the PR and also the QRS intervals. I'm not concerned with the ST interval and the Q to T interval right now. You'll get more information with that in Adult 3. Next, the last column, which is the life-threatening. I want to know if this rhythm can kill the patient. So you'll look through your information. Is sinus rhythm a dangerous rhythm? You're going to answer yes or no, and you'll do that for each of the cardiac rhythms. Some of them may be a maybe. For example, sinus tachycardia with a rate of 101 or 110. Is that dangerous for your patient? Maybe. It depends, because they may go from sinus tach to paroxysmal supraventricular tachycardia, which is a rate that's in the 200s. So yes, that could be dangerous. Or atrial fibrillation. Is it under 100? That means it's controlled. They're probably taking some medicine. Is it over 100? And if the answer is yes, then it's uncontrolled, and that could potentially be dangerous for your patient. So I know it's kind of far back. You probably can't see very well, but that's how I want you to fill in the chart. So and also again, the video that I'm going to attach also to this email, it gives you a really good explanation of how to interpret cardiac rhythms. And now if I don't tape it, then I'll look for another video that goes in depth, and it'll show you about AFib, aflutter, VTach, VFib, and the treatment for those rhythms. For a reference, the information is in your textbook, but another book that I also found that was easy to use is this one. It's EKG interpretation, made incredibly easy. I think it's like $35 or $40. You do not have to purchase this book for this class, but once you get into your practice, if you work on a unit like telemetry or med-surg or ICU, where your patients may be connected to a monitor, then this is a good reference book for you to use. So if you have any other questions, feel free to email me, and you can watch the next video after this one. Have a good night.